Good afternoon, today is May 8th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that California has begun its reopening. And we are now moving into the stage 2 of the California's reopening plan, in which lower risk businesses and manufacturers and suppliers can start opening with slight modifications by adapting to social distancing and such. So, however, while these changes aren't drastic, they are still meaningful modifications, which means that some retail businesses can open in time for Mother's Day, which is on the 10th, and as well as just stores are beginning to reopen. However, I personally think that while the stores may be opening, the customers won't be going into stores as they were before the pandemic, because in other states where remote opening has started weeks before, stores are still not seeing many customers, as Americans are still hesitant to go out despite the government's energy for us to go out. And I think this is safe, but just to think that if you need anything, or you can now return to stores or do some shopping. The second thing that I like to talk about is that Latinos are seen to be being hit widely, as they are now getting sick almost twice as time, almost just many times the number of other populations getting sick. And this is just an extremely drastic and alarming thing for doctors to see. The Latinos account for more than 20% in Iowa. Latinos account for more than 20% of coronavirus cases, though they're only 6% of the population, and worse numbers can be seen in other states too. Public health experts say that this is because they may be more vulnerable to the virus as a result of having low-paying service jobs, a large number lack access to healthcare, and they also have conditions such as high risk of diabetes that can worsen infections. So, mostly we can see this in states where the Latino communities are not they weren't well established. For example, in Oregon, we see a huge number of Latinos getting sick, and this is mainly just because they don't have, they're just working low-paying jobs and don't have the support system in place to help them through this crisis. However, there are some Latinos in states like California, where they're extremely well established, and they are likely to have middle-class jobs or the sort of wealth that could help them tide over through the pandemic without having to work outside the home. So, I just think that while they are hit quite hard, it still differs in each state. The third thing that I'd like to talk about is that the distribution of the antiviral drug remdesivir has become mired in controversy. So the FDA granted an emergency approval to the antiviral drug remdesivir for treatment of the hospitalized virus treatment. So remdesivir is currently the only treatment so far shown to be effective in speeding up recovery by about 30%, but it did not decrease the death rate in a federal trial done to test the drug. However, what the problem here is that, the drug is approved, the question is which hospitals are going to receive the drugs. And the problem here is that small community hospitals with few or no virus patients have been receiving the drug, while large hospitals have just been denied the drug. And I personally think this is extremely a large problem, because hospitals were told to inquire AmerisourceBergen, which is a list that which hospitals could get the virus, but nobody knows who created the list or what was the criteria for inclusion. So, as a result, hospitals don't know why they are refused the drug, even though clearly they obviously need it, while some community hospitals are just getting the drug. And I feel like this is kind of like a joke. I mean, like, the drug is approved, there's a drug coming out, but yet large hospitals that need them can't have them. So I think that here we all the federal government should step in and distribute the drug to where it actually needs and not where it is not needed. Thank you for listening, and I hope you have a good day.